On Friday, a federal panel stacked with appointees handpicked by HHS Secretary Robert F. Kennedy Jr. decided on new rules for getting the COVID shot, which could make the vaccine, it really kind of will make the vaccine less available than it has been in years. The Advisory Committee on Immunization Practices, known as ACIP for short, voted in favor of recommending that people under the age of 65 consult a doctor before getting the COVID vaccine. This is different from its past recommendations for all Americans ages 6 months and older to receive annual coronavirus shots, and it creates a hurdle for Americans who've always been able to get the shot without having to justify it. A day prior, the panel, which crafts recommendations on vaccine policy for the CDC, also voted to restrict the use of MMRV vaccine. Now, you probably know about MMR. MMRV is a vaccine. It's a combination vaccine that protects against the MMR, measles, mumps, rubella. The V adds chickenpox. The panel advised that the vaccines should no longer be given to children under the age of 4. Kennedy, of course, is I don't know how to say this. We call him a longtime vaccine skeptic, but that doesn't really capture what he actually is. He's publicly promoted conspiracy theories around vaccines in the past, and he has profited from lawsuits involving vaccines. Not to mention that the ACIP panel that he handpicked, many of his appointees, are also known vaccine critics. These days, we take for granted that certain diseases are simply not a part of our day-to-day lives. We just don't worry about getting smallpox or polio. But it hasn't always been that way. For the vast majority of human history, we didn't have vaccines. And while some people, Methuselah comes to mind, did live long, healthy lives, not everybody was so lucky. In 1900, the U.S. life expectancy was 47.3 years. And that's not because a whole lot of people were dropping dead in middle age. It was because the average was brought down by so many infants and young children dying of diseases that now, thanks to vaccines, are entirely preventable. Life expectancy in America today is 78.4 years, largely thanks to the fact that we've crushed many diseases with widespread vaccination. Take, for instance, measles. The historian Kyle Harper, in conversation with David Frum for The Atlantic, recently discussed the disease, explaining in part that it's a respiratory disease. So if a person infected with measles walks into a room of unvaccinated people and coughs, there's a higher risk that those people will get infected than any other disease we know, end quote. Than any other disease we know, measles. Now, before the introduction of a measles vaccine in the early 1960s, the U.S. saw millions of cases of measles every year. According to the CDC, in the decade before the vaccine, on average, 3 to 4 million people were infected annually. 400 to 500 died annually. According to studies, in the decade after the introduction of measles vaccines, measles deaths declined by 90%. Measles was on the path to being completely wiped out, akin to smallpox, which is the only human pathogen that is considered to be completely eradicated. Measles was considered eliminated in the U.S. in 2000, with no documented cases for over a year. But as a recent NBC News investigation reveals, childhood vaccination rates have been dropping across the country in recent years, and now we've seen nearly 1,500 documented cases of measles in the United States this year. That's the highest level in more than a quarter century from a disease that we were on the brink of wiping out completely. Joining me now is the aforementioned Kyle Harper. He's a professor of classics and letters at the University of Oklahoma. Harper's work focuses on the history of infectious disease and climate change and their impact on human societies. He's the author of multiple books, including Plagues Upon the Earth, Disease and the Course of Human History. And Kyle, you are exactly the person we want to talk to about this, because I was looking for somebody who can just study this and put this in context, forgetting the specifics, and we'll talk about the specifics in a moment about vaccines and their risks. Forgetting that for a second, can you just characterize for me the effect that vaccinations have had on our lives to the extent that we don't think about these diseases other than if your kid has to get a vaccination?
Right. Well, thanks for having me. Although I'm sorry that this kind of perspective from the human past is needed. But yeah, vaccines are arguably the innovation, the discovery that has done more than any other to contribute to health and longevity and overall human well-being. Not only the sickness and suffering that patients who are infected with diseases endure, but also the effects and trauma that claims on loved ones and the rest of society. I think historical perspective is needed here because we simply are too apt to forget that for most of the human past, infectious diseases were difficult or impossible to control. And we've invented a series of technologies and medical tools to help us control diseases, and vaccines would be right at the top of the list.
It would be interesting if this were simply a scientific discussion, because there are risks associated with all vaccines. We 100% know that. We're working toward a world where there are fewer risks associated with them. But that's not actually the discussion happening at HHS or CDC. These panels are now populated with vaccine. Again, I don't know what word we use to call them. I don't think skeptics is actually the right thing to call them. But they're anti-vaccine people, some of whom, including the Health and Human Services Secretary, have profited off of taking that position. So this isn't a good faith scientific discussion.
That's right. I like the way you distinguish between real skepticism and just ideological opposition to science or pseudoscience, because skepticism is good. And I think we should acknowledge from the very beginning, people have been wary of vaccines as well, and that's totally fair. It's a very serious power for the government to make compulsory any kind of medical treatment, especially one that involves an injection like vaccines. That's fine. We do have very, very high bars for the kinds of decisions that lead to compulsory vaccination. So it's very important to distinguish legitimate skepticism, which is a part of science and which can build trust, and just pseudoscience. And I think as a historian, I perceive these issues to be very much about the relation between science and public trust and polarization, not really the science of infectious disease and vaccination.
That's an important discussion. I'm happy to host a debate from people about very, very specific applications of very specific vaccines and what they might do. But here's the other issue. I don't think about a lot of these diseases because they don't exist, and we have, or at least they're not common, and we've got we've developed some sort of a herd immunity. So somebody gets on an airplane that I'm on and they've got measles, likely won't spread too much because most people on that plane are going to be infected, but not will be immunized, but not all of them will be. And that's the problem. We've gotten used to this concept of herd immunity. If some people stop getting vaccinated, it will have an effect on many more of us.
Right, and that's why these are issues of public health and of public trust, because we're all in it together. We share space, we touch the same handrails, we breathe the same air, and so we have a kind of responsibility not only to ourselves but to one another. And vaccination has always been about the safety and health of the community. And like you say, no vaccine is 100%. There's never a magic bullet. But what vaccines do is they not only provide you with boosted immunity, but they prevent diseases from spreading. These are communicable diseases. They're spread in the water, they're spread through the respiratory route. And so we have to take what tools we have in order to stop them from transmitting from one person to another. And so the reason why we get vaccinated is because it provides collective immunity against these kinds of infections.
Dr. Harper, good to talk to you. Thank you. I hope we can have more conversations and we can just enlighten people about some of these issues. Kyle Harper is a professor of classics and letters at the University of Oklahoma. He's the author of multiple books, including Plagues Upon the Earth, Disease, and the Course of Human History.